Hello and welcome to the July 2024 PSV training on CLF Helpline. My name is Tyler Ambrose and I'm the Peer Support Coordinator. If you ever need to get in contact with the Peer Support team, reach out to us at support@concussionfoundation.org. A brief overview of the training today. First, we're going to talk about the helpline stats. Then we're going to talk about what is the CLF helpline, how does it work, what resources are available, and how can this be helpful to a peer support volunteer. The CLF Helpline was established in 2019 and has, up to date, served 6,557 people. That means us averaging about 104 helpline requests a month, with a 3-day response time to every helpline request. CLF has vetted more than 7,000 medical and mental health providers throughout the US and Canada for our helpline database. CLF looks for providers with the correct training and experience to support patients and families with concussion, post-concussion syndrome, and suspected CTE. The main core of the helpline that helps for patients is medical resources, educational resources, the peer support one-to-one connection program, and the peer support Zoom groups. Almost all partners come in from the helpline and have at times gotten services or providers, and through their navigation of their recovery, coping, or their journey through the difficulties they're going through, might need new services or providers. So it's always a good practice to check in with your partner about the helpline. At a glance, the helpline is a form that a client or patient or caregiver can fill out to collect resources, providers, or information that could be beneficial to them. It also gives the opportunity to book with the helpline coordinator to go a little bit more in depth into what they're dealing with so they can get more specific resources to help them. The CLF helpline form can be found on the CLF website. As for peer support volunteers, easiest to find in through the training guidebook on the PSV Hub. The video here is about a former partner who'd gone through the one-to-one connection program and used the helpline. It's a great video to watch to learn how the helpline and the one-to-one connection program connect together and can help your partners or patients coming to. Something of noting is that the helpline is not a medical or mental health provider. It is not a crisis intervention service, and it is not a call room or 800 number. Very briefly, I'm going to walk you through the helpline form so you can get a better understanding of what that form looks like and how it functions. It starts with collecting individual information, contact information, so that we can understand where a person is, how to get in touch with them, and what services in their area we can provide. One of the really important parts is how to be contacted. We understand that many different symptoms can cause issues with text screens, and so we offer text, email, and phone call by appointments with the helpline coordinators. The patient information is really important for us to understand age, where you're coming in from, what you're dealing with, such as, concussion or CTE or clinical research, what providers or recommendations you're looking for, how far you're willing to travel, what kind of repetitive head injuries or trauma you've been through in the past, how those traumas have occurred from, say, sports, military service, when they occurred, such as in college or in high school, and what symptoms you've really gone through so we can understand an overarching understanding of kind of what a client is going through. And then lastly, we go over, what someone is really going through if they're in crisis. We can reach out immediately to make sure that they're safe, or we have, a box for relevant information. If any of those crisis words are found, we can reach out to help immediately. And of course, all of this information is secure and confidential so that only CLF will have access to it. So with that crisis situations, while CLF Helpline is not a crisis intervention service, our team prioritizes immediate crisis escalations to connect with clients at risk of imminent harm with crisis experts. So as you saw, we had a crisis panel of 1 to 5, 1 not being crisis, 5 being an active emergency. Or we have, 100+ crisis keywords that are flagged through the helpline form. If we find someone that's in crisis, we try to get in contact with them, jump on a phone call, texting them constantly to make sure that they are in a safe environment, they themselves are safe, and we connect them with emergency services or crisis counselors so that way they can really get the support and help that they need. Some other resources that we like to pass out for people who are struggling are substance abuse and mental health illnesses, for veteran services, and those domestic violence survivors or people who are currently going through domestic violence. And we want to make sure that we get them the support that they need, as well as always offering different types of therapies and providers as recommendations for things to try out as information on those as well. So the helpline is great to be able to connect people with other resources when their needs kind of fall outside the scope of what the CLF helpline is for. As a peer support volunteer, understanding that the helpline can offer is a great way to think about it is, support, more ways that a partner can really connect with those around them that understand what they're going through, such as the Zoom groups. Providers maybe finding a mental health counselor or therapist to talk to, information about maybe clinical research opportunities for those who are looking for a little bit more information, resources for military veterans or domestic violence survivors and people currently going through it, compassion on how to get more involved with CLF and help out more, and of course any kinds of questions such about specific treatment options or providers. The helpline is a great resource for peer support volunteers to know that you don't have to figure out a partner's problems. You don't have to fix them. You're there to support them. And a great way to support them is if they're going through any of these options or, they mention any of these, that you remember the helpline is there for them and you can always refer them to the helpline. To go in a little bit in depth understanding how that works, and if then situations, if you hear a partner say, I heard of a new therapy, but don't really know much about it, you're welcome to talk on your direct experience with a therapy if you've gone through yourself. If not, you can always direct a partner to their designated helpline coordinator to ask about a specific therapy. It can be beneficial either way if you do or do not know a lot about this therapy, as we can provide a little bit more direct information. And possibly even some recommendations for providers in their area. If your partner say, I'm really struggling with symptoms, I don't know what to do, suggest the partner find support through the helpline, information, resources, and peer support groups that can give them a broader base of coping mechanisms or options that can really target some of the difficulties that they're going through. If your partner is dealing with some visual or overstimulation from screens, you can always offer to help partner fill out the helpline form. It can be a little tedious with some people going through difficult symptoms. So if the partner is trusting you with their personal information to kind of help fill out that form with them, please always feel free to. It's not an obligation. You can jump on a phone call or a Zoom call to kind of help them out. And as peer support volunteers, if you ever think that your partner may need additional resources or support, reach out to your designated peer support coordinator at support@concussionfoundation.org. We're going to be there to support you. The helpline is going to be there to support you. CLF is there to support you. If you're ever in need of any kind of information, have any other kind of questions, always reach out to us immediately at support@concussionfoundation.org. Thank you for listening to this training and hope you have a wonderful rest of your day.